pagi kepada Bapak Ibu penilai dalam sertifikasi dosen tahun 2025. Perkenalkan, saya Erlinna Juita. Saya adalah seorang dosen di Akademi Kesehatan John Paul II Pekanbaru. Video ini merupakan salah satu persyaratan untuk melengkapi pengajuan sertifikasi dosen pada tahun 2025. Pada bagian pernyataan diri dosen dalam unjuk kerja Tridharma Perguruan Tinggi PDD-UKTPT unsur pengajaran. Sebagai informasi, saya adalah dosen pengampu mata kuliah Bahasa Inggris pada program studi D3 Analis Kesehatan Akademi Kesehatan John Paul II Pekanbaru. Deskripsi mata kuliah Bahasa Inggris ini berbobot 4 SKS yang dibagi ke dalam 4 semester dengan fokus pada English Proficiency dan English for Specific Purposes. Di sini saya memilih mata kuliah Bahasa Inggris 3 untuk ditampilkan pada video pembelajaran. Mata kuliah ini dikembangkan untuk memenuhi kebutuhan berbahasa Inggris sesuai dengan profesi analis kesehatan. Mata kuliah ini terdiri dari 1 SKS praktik yang berfokus pada membaca dan demonstrasi dalam bentuk peragaan sesuai dengan referensi laboratorium, serta komunikasi berbasis individu yaitu dengan pasien dalam pengambilan sampel klinis maupun komunikasi berbasis masyarakat dalam bentuk promosi kesehatan atau public speaking. Capaian mata kuliah yang diharapkan yaitu mahasiswa diharapkan mampu berkomunikasi dan melakukan presentasi atau public speaking dalam bahasa Inggris sesuai dengan bidang profesinya, serta mengaplikasikan prosedur-prosedur laboratorium sesuai dengan referensi manual laboratorium. Dalam hal ini saya menggunakan rujukan dari WHO. CPNK ini kemudian menghasilkan 6 sub CPNK yang dipenuhi dalam 16 kali pertemuan, terdiri dari 14 kali tatap muka dan ada 2 kali ujian. Adapun materi pembelajaran dalam bahasa Inggris 3 ini meliputi ada blood specimen collection and processing, deskripsi alat-alat yang digunakan untuk pengambilan darah. Di sini mahasiswa bukan hanya mengenal nama-nama alat tersebut dalam bahasa Inggris, tetapi juga mampu mengoperasikannya sesuai dengan referensi manual laboratorium yang dibacanya. Venipuncture procedure, finger stick procedure, heel stick procedure, yaitu prosedur-prosedur pengambilan darah vena dan kapiler yang merujuk kepada referensi WHO. Rapid test, prosedur rapid test untuk berbagai tes cepat yang dilakukan di laboratorium. Identifikasi elemen-elemen pada requisition form atau formulir permintaan laboratorium test dan elemen-elemen pada lab test result. Kemudian ada komunikasi dengan pasien dalam pengumpulan spesimen klinis, itu yang mencakup spesimen darah, urin, sputum, dan feses. Health promotion atau promosi kesehatan berupa edukasi kesehatan kepada kelompok-kelompok masyarakat. Metode pembelajaran ini yang sesuai dengan mata kuliah ini adalah dalam bentuk small group discussion, simulation, dan role play. Saya membagikan materi pembelajaran seperti video pembelajaran, bahan ajar, dan melakukan kuis dan tugas terjadwal melalui LMS yang digunakan kampus yaitu Edlink. Kriteria penilaian pada mata kuliah ini mencakup kehadiran 10%, tugas dan kuis 20%, UTS 30%, dan UAS 40%. Asesmen ini dapat diakses oleh mahasiswa melalui Sistem Informasi Akademik AKJP 2 Pekanbaru. Berikut adalah video rekaman pembelajaran microteaching pada pertemuan 12 mata kuliah Bahasa Inggris 3 yang membahas tentang komunikasi antara analis kesehatan dengan pasien dalam pengambilan spesimen darah vena. Okay, good morning. Morning. How are you today? Fine. Okay, so now we are in 12th meeting. The topic for today is communication between medical technologist and patient. As you know that English in this semester is English for specific purposes that aims to help you in your future career as a medical technologist. And after this discussion, you will practice how to communicate with patients. So firstly, I want to ask you, what is communication?
Miss?
Yeah, Anya.
Interaction between two people or more.
That's good. So people exchange information, ideas during communications. Next question. Is communication important for medical technologists?
Yes.
Yes. Why?
Miss,
Okay.
the communication might reduce patient anxieties.
Yes, that's good. Communication can reduce patient anxieties. Some people, unlike healthcare providers, are sometimes scared of needles, right? And then some of them might be shaking before having their blood drawn.
Miss,
Yeah,
some children are even hysterical during the process.
that's right. So that's why a good communication can promote success during specimen collections. So now let's discuss the procedure. Let's see the next slide. In drawing blood, so these are the procedure. So firstly, you have to introduce yourself to your patient, and then you have to identify the patient using two patient identifier. After that, you have to explain the procedure you will be performing. This is to maintain trust between you and the patients. And then you have to prepare the patient based on the task requirements. And after that, you can begin the procedure of venipuncture. Any questions so far? No? Okay, now let's discuss this one by one. First, introduction. So firstly, don't forget to greet your patient. You can say good morning in the morning, good afternoon in the afternoon, or good evening to your patient, sir or ma'am. And after that, you can introduce your name and your position. For example, my name is Suliani. I am a medical technologist at this hospital. So your patient are aware that you are here to collect specimen. Okay? And then after that, you have to do patient identification. Okay, is there anyone here who can help me read this slide?
Me.
Okay, Daniel.
Patient identification. The laboratory used the patient identifiers and identification of all patients before the procedure begins. Typical, the patient's first and last name and date of birth are used. Precaution, maintain awareness for sound-alike names and suffix during patient identification. Example, Gonzalez and Gonzalez, senior and junior. What's your name? What do you spell your name? What is your date of birth?
Okay, thank you, Daniel. Thank you, Daniel. So the laboratory uses two patient identifier for identification. What are they? Yeah, Suliani.
Name and date of birth.
That's good. Name and date of birth. First, to ask the patient name. So you have to ask, what is your name? What's your name? And then don't forget to ask the patient how to spell their name. You can ask, how do you spell your name? Okay, any questions? Yeah, Donna.
Question is, why do the patient need to spell their name? In Indonesia, we never ask the patient to spell their name.
Okay, thank you. Is there anyone here who can help me answer this question?
Yes.
Yeah, Diva.
I try to answer the question. I think it because how the name is written is different from how it is read.
Okay, that's right. That's a good idea. Because in English, in Western styles, how the names are written different from how the names are read. So we have to make sure. For example, the name Catherine can begin with C or a K, and it sounds alike with Caitlin, Kathleen, and so on. Do you have any other question? No? Okay, next one. Explaining the procedure. So next you have to explain the procedure to your patient. The procedure, I will introduce a small needle into your vein and gently draw some blood for. So you have to mention the type of the test that will be performed here. For example, blood glucose test. And then you will say, I will label them with your name and contact details and send them off for the task to the laboratory. The result will be returned to doctor. Don't forget to mention the name of the doctor requesting the test here. And then after explaining the procedure, don't forget to ask once more to make sure that your patient understands the procedure that you have explained. You can say, do you have any questions? Did you understand what I explained to you? That's it. Do you have any question? No? Is it clear so far?
Yes.
Okay. Next, patient preparation. So firstly, you can say to your patient, please sit down and make yourself comfortable. If your patient have sat down, you can say, now I will ask you a few questions. The first two questions, have you ever had blood taken before? Are you scared of needles? You can ask this question if your patient look nervous. So you have to make sure whether this patient has ever his or her blood taken before. You may slow down the process if the patient look nervous. And then, are you allergic to anything? So you have to make sure that the patient is not allergic, for example, to latex or iodine or tape and so on. This is for patient safety. And after that, you can ask, have you taken any supplement or medication in the past 10 hours? Do you know how we need to ask this question to patient? Yeah, Lewinda.
Because some medication or supplement might interfere the test result.
That's right. So you have to note this in the requisition form. And then the last question that you have to ask the patient, have you eaten or drunk anything in the past 10 or 12 hours? Why do we need to ask this question? Angela?
Because some tests require the patient fast for certain hours.
That's good. Because some tests requires patient to fast for certain hour. For example, fasting blood glucose, for example, or cholesterol test. So the patient needs to fast for 10 to 12 hours before the procedure. So you have to make sure this. Okay, do you have any question about this? No? Now you can perform the venipuncture. But before that, you have to ask, shall we start? Don't suddenly insert needle to your patient. Let's say, shall we start? If you feel or unwell or uncomfortable, please let me know at once. If your patient say yes, now you can begin the venipuncture procedure. Okay. Here are the types of blood tests in English. There are 10 examples of blood tests in English. Do you have any question about this?
Miss,
Yeah, Alin.
what does complete blood count mean?
Complete blood count.
Yeah.
Complete blood count means the same as hematologi lengkap in bahasa Indonesia. Okay. Is there any other question?
No.
No? Okay, now you can practice in a group of 2 with your friend about this procedure. And after that, I will assign some of you to come to the front to practice. Okay, now. Okay, time's up. Now I need 2 students to come to the front to practice the venipuncture procedure. Resti, please come to the front with Daniel. Okay.
Good morning, sir.
Good morning, Miss.
My name is Resti Andini. I am a medical technologist in this hospital. What's your name?
My name is Daniel Chandra. You can call me Daniel.
How do you spell your name?
Daniel.
What is your date of birth?
March 27, 2002.
Okay, I will introduce a small needle into your vein and draw some blood for cholesterol test. The result will be returned to Dr. Smith. Do you have any question?
When will the result be informed?
In 2 hours. Do you have any other question?
No.
Okay, did you understand what I explained to you?
Yes.
Okay, please make yourself comfortable. I will ask you a few questions. Are you scared of needles?
Of course, no.
Are you allergic to anything?
No.
Have you taken any supplement or medication in the past 10 hours?
No.
Have you eaten or drank anything in the past 10 hours?
No.
Shall we start?
Sure.
Okay. If you feel unwell or uncomfortable, please let me know at once.
Yes.
Okay.
Okay, so that's one example about communication between medical technologist and the patient. And I like how the medical technologist can respond to the patient's question, for example, about the result, right? In real situations, so you have to be ready to answer the patient questions. Is there any question so far? No. So this is the end of meeting, and don't forget to practice outside the class. In the next meeting, I will assign some of you to come to the front to practice the venipuncture procedure before we come to the next discussion about urine specimen collection. Okay, so see you next week.
See you.
Demikianlah video pembelajaran ini saya buat untuk melengkapi pernyataan diri dosen dalam unjuk kerja Tridharma Perguruan Tinggi PDD-UKTPT. Semoga dapat menjadi bahan pertimbangan Bapak Ibu tim penilai. Saya mohon maaf atas segala kekeliruan dan kekurangan, dan terima kasih.